My name is Nakia Parker, and I'm a registered nurse who, previous to becoming a registered nurse, was living in poverty. I went several years after graduating high school without having insurance. There were a few instances where I ended up with pneumonia each winter, and so when I needed to seek healthcare, I'd just go to the emergency department because I knew that they would treat me. Even though I'd have a larger bill later, at least I would get treated and not at the primary care office where I didn't have the $90.
My name is Michael Collins. I'm the medical director for the health department in Grand Traverse County and also been the Leland District Health Department. And I'm a physician. I also have a master's in epidemiology from Michigan State. So all too often somebody who's economically deprived just receives medical care when they're quite sick. They may receive care from somebody who doesn't know them at all, who may be a physician in training. And then if they're real sick, there's nobody there to sort of coordinate the care, and often their care is more fragmented.
I'm Tom Emling. I'm Michigan State University's off-campus regional director here in Traverse City. So we know the impact on health in terms of diabetes, in terms of obesity, and so on. For families on the edge, for families in poverty, those are huge consequences that are really impacting them.
I think being in low economic situations affects health in many different ways, and one of them probably is the kind of food that's available to people who are economically deprived. They may not have grocery stores that are close by. Access to fresh fruits and vegetables may be difficult, and often food that's good for you is more expensive than processed foods that are quicker and cheaper, but not as good for you. And after all, you are what you eat, and eventually eating badly takes a toll on everybody's health in terms of diabetes, obesity, heart disease. I think what everybody should know about the effects of poverty on health and health on poverty is that it is a vicious circle in many different ways. Being poor adversely affects health, and in many different ways being ill adversely affects somebody's ability to save and be economically independent.
If I were cleaning for a day, I wouldn't see anyone in the emergency room because they have a head cold. We wouldn't be intubating 30-year-old women who are suffering from a completely preventable sepsis due to a dental abscess that they couldn't get treated. I don't think anyone in this country should have to go bankrupt or lose their home or be forced to live in poverty because they can't afford to maintain optimal health. The equity of healthcare in Uganda was better than the equity of healthcare in America. It was a level playing field. Everyone had the same access to the same healthcare, and no one was treated differently, and no one was told that your poor health is your fault